Hello everyone, we are from small group discussion B7 and we are going to present our study project entitled Chronic Venous Insufficiency. First of all, let me introduce myself. My name is Fernando Gosali and my last digit of student number is 036. So here's our outline. The first capture is introduction, second capture is content, and the third capture is conclusion. That's all from me, thank you.
Hello everyone, my name is Priscilla Wijaya with the last digit name is 36 and I will explain the chapter 1. Start from the 1.1 background information. So chronic venous disease or CVD encompasses a wide range of venous conditions characterized by significant impairment of blood flow in the lower limbs. And chronic venous insufficiency or CVI arises from prolonged venous hypertension during walking. Optimal management of chronic venous disease necessitates a collaborative healthcare team approach involving various professionals. Based on the urgency that has been explained, it is very important to understand CVI as early as possible. Therefore, we compile this literature to increase understanding of CVI and help study about CVI further. 1.2 problem formulation. So there is 8 of problem formulation and will be explained in 1.3 objective. And the last one is 1.4 benefits. In addition, the student projects is also expected to be a reference for another research related to chronic venous insufficiency. Maybe that's all from me, and the next page will be explained by my friend. Thank you.
Hello doctors and friends, my name is Jovita Theodora Liu with last 3 digits 114. Now I will explain to you about the definition of CVI. Chronic venous insufficiency, or CVI, is defined by morphological and functional abnormality that is characterized by inadequate blood flow through the veins. CVI usually happens in lower limbs. It occurs when the valves within the veins weaken or become damaged, leading to blood pooling or stagnation in the veins. CVI involves lower extremity edema, trophic skin changes, and discomfort secondary to venous hypertension. CVI is a prevalent disease process that can contribute to a diminished quality of life and loss of work productivity. Untreated CVI can lead to post-phlebitic syndrome and venous ulcers. The patient may complain of pain, leg swelling, pruritus, and skin discoloration. That's all from me. Thank you.
Hi everyone, my name is Kadra Kankimula with lecture number 009. So here I would like to explain about the epidemiology of CVI. The prevalence of CVI is mostly 2 times higher in women than it is in men. The prevalence increases with age, such as 21% in men above 50 years old and 12% in women above 50 years old. The global incidence of CVI reaches 40.8%, and more specifically in adults, the number ranges from 5 to 30% of cases. In the US alone, the incidence reaches around 40% of cases. On the other hand, recording and data collection regarding the prevalence of CVI in Indonesia is not yet available. So that's all from me. The next will be explained by my colleague. Thank you.
Now, we will move to the chapter 2.3, which is the etiology of chronic venous thrombosis. My name is Jeremina Penel Herdia, with student number 26. The primary culprit behind CPI is venous hypertension, caused by the failure of leg vein valves to prevent the backflow of blood, exacerbated by obstacles like blood clots. This situation results in increased venous pressure, vessel dilation, valve incompetence, and eventually venous reflux, exacerbating the condition. CVI can be categorized into primary and secondary forms. Primary CVI, accounting for about 70% of cases, often stems from inherent issues in the venous system like genetic defects or chemical imbalance. This leads to structural weaknesses, making the veins prone to dilation. Secondary CVI, making up the remaining 30% of cases, usually follows deep vein thrombosis or DVT. DVT-induced obstruction escalates venous pressure, damaging the valves and inciting inflammation that further impairs vein walls. Risk factors for CVI are varied, including non-modifiable elements like genetic predisposition and modifiable lifestyle choices such as obesity, smoking, and vascular injury.
Good morning, my name is Gravis Lamnung with last 3 digits of student number 085. Now I'm going to explain about the pathophysiology of chronic venous insufficiency. So commonly the venous system consists of muscle pumps, one-way valves and veins. But If there is an impairment in muscle pump or one-way valves for long period of time, then could develop a disease called chronic venous insufficiency. And if left untreated, chronic venous insufficiency could cause secondary muscle pump dysfunction, vascular valve failure exacerbation, deep vein thrombosis, and even restructure the veins to become more susceptible to cardiovascular disease. Furthermore, it could also cause thermal changes like hyperpigmentation and thickening due to fibrosis of subcutaneous fat. That's all from me, and thank you.
So, greetings, doctors and friends. My name is Abel Manuel Sianipar with three last digit of student number 118. Now, I will be explaining to you guys about the clinical manifestation of chronic venous insufficiency. So, this disease itself, the CVI, show itself in some several ways, such as swollen legs or edema, varicose veins, leg pains, and skin changes or skin ulceration, as you can see from these pictures. So, for varicose veins itself can become painful, right, and inflamed. And the swelling will start around the ankles and move up to the leg. Leg pain, especially after standing for a long time, feels heavy or achy and improves when you elevate your leg. This discomfort might be due to pressure buildup in the leg. Block deep veins can cause leg pain during activity that gets better with rest. And some skin changes, including darkening to the iron deposits. Okay, so that's all from me. Thank you.
Thank you so much for the time. My name is Deputo Adena Praina with 3 digits number 178, and I will tell you about the diagnosis of CVI. So to diagnose CVI accurately, a thorough medical history review and comprehensive physical examination are essential. Visual inspection and palpation during the examination can detect evidence of venous disorders such as telangiectasis, reticular veins, or varicose veins. Skin abnormalities like hyperpigmentation, status dermatitis, or atrophy blanche should be noted. Assessing edema severity and distribution is crucial, along with palpation for tenderness and checking for ulcers. Besides tests, including the Brody-Telenburg test and Hiller-Doppler, aid in distinguishing between deep and superficial reflux. Varicose veins taking more than 20 seconds to dilate suggest superficial reflux, while rapid dilation indicates deep or combined venous reflux. Confirmatory non-invasive tests such as venous duplex imaging help pinpoint the presence and location of CVI accurately. And during the diagnosis, it is vital to consider differential diagnosis, ruling out acute venous issues like deep vein thrombosis, and evaluating systemic factors such as heart failure or medication side effects. Critical disorders like lymphedema or lipedema should also be explored, along with regional concerns such as soft tissue hematomas or gastrocnemius tears.
My name is Tiffany Cecilia with real last digit number 170, so I will explain about the treatment and management. Initially, conservative approaches such as leg elevation, exercise to enhance calf muscle function, weight management, and compression therapy are recommended. Ulcers are effectively managed with compression bandages, although there's a risk of infection and the rare occurrence of cancerous transformation known as Merielian ulcer. Caution is necessary when applying compression therapy to patients with coexisting peripheral arterial disease, which should be addressed before initiating compression treatment. Surgical intervention may be necessary for ulcers that don't respond to compression. Regardless of the chosen surgical procedure, recurrence is common and it's essential to combine it with compression stockings for optimal results.
Hello, my name is Dea Kalisarana Putri with the last digit number 129, and I will present you about the complication of chronic venous insufficiency. Chronic venous insufficiency or CVI is an life-threatening condition. However, if left untreated, it can lead to serious complication. A common complication of chronic venous insufficiency is the appearance of venous ulcer, which may be associated with thromboembolic events. Skin change may occur as a sign of a pre-ulcerative condition. Venous ulcers generally have a poor prognosis due to delayed healing and recurrent ulceration, which may increase risk of developing superficial thrombophlebitis. When superficial thrombophlebitis occurs, it is often associated with deep vein thrombosis and pulmonary embolism. After DVT, up to 50% may develop post-thrombotic syndromes, and in addition, prolonged CVI can contribute to the development of lymphoedema.
Okay, my name is Mdaki Aminusdia with RAS digit number 05. So I would like to explain about the prognosis. The prognosis for CVI can vary based on several factors, including the severity of symptoms, the presence of complications, and appropriate diagnosis and treatment. Generally, CVI tends to be chronic and progressive, but early detection and appropriate intervention can significantly improve outcomes. Without proper intervention, the condition will become more progressive. One of the most common and difficult to treat complications is chronic venous ulcers. Approximately 60% of individuals with these ulcers develop diabetes, with over 50% progressing to DVT. Meanwhile, surgical options for CVI have not proven entirely effective despite the availability of various procedures. Okay, that's all from me. Next will be explained by my partner.
Hello everyone, my name is Fiona Natania Santoso with my last three digits student number ID are 249. Now we are going to discuss the chapter 3, which are conclusion and suggestion. So, the conclusion from our student project, chronic venous insufficiency or CVI, is characterized by inadequate blood flow through the veins, and it occurs when the valves within the veins become weakened or damaged, and it resulting the venous hypertension of the lower extremities. The patients may complain such as leg pain, swollen legs, pruritus, skin discoloration, and also varicose of the veins. CVI can be detected through the inspections and also the palpation. From the inspection, we can see bulges on the surface of the skin that may indicate the presence of the dilated veins. And from the palpation, we can reveal tenderness along the dilated veins. And for the addition, we can also use classic tourniquet test or continuous wave Doppler for the evaluation. The therapy that is recommended for CVI, including conservative approaches such as leg elevation, compression therapy, the exercise to enhance the leg muscle function, and also body weight management. And generally, CVI tends to be chronic and progressive, but with early detection and appropriate intervention, we can significantly improve the outcomes of the patient. So, for this topic, our group suggests that CVI can lead to many complications, but by understanding the risk, the cause, and knowing the signs of symptoms, the pathophysiology, or doing the right assessment, we can improve the outcomes of the patients, or even we can prevent the incidence of CVI. So, by understanding more in depth about CVI, we are able to know and make improvements to the diagnosing method in the future. Thus, we can help promote the patient's quality of life. Okay, that's all the presentation from student group discussion B7. We would like to thank you for the attention and we would like to sorry if there's any mistakes that we made. So the presentation will be end here. Thank you so much.